Let me ask you something. When you think of a nurse, what's the first image that pops into your head? Someone taking your blood pressure, giving you a shot? Yeah, it's usually something practical, right? A specific task. But what if I told you that's just the tip of the iceberg? Today, we're going to peel back the curtain on one of the world's most essential professions to really get at the deep science of caring that defines what it's all about.
Okay, so let's just get right to it. We're going to start with the big one, the question this whole explainer is really about. What is nursing really? I mean, beyond all the stereotypes and the TV dramas, what is the actual core idea that drives this entire discipline? I'm willing to bet the answer is not what you think.
Because here's the thing. It turns out nursing is so much more than just a list of things to do. It's a full-blown science. It's a unique way of seeing the world. And it's all built on a complex interplay of some really specific foundational ideas.
So here it is. This is the crucial point. At its academic core, nursing isn't about procedures, it's about relationships. Specifically, it's the study of how 4 key concepts connect and influence each other to create what we call the human health experience. You know, what it actually feels like to be healthy or sick or somewhere in between.
And here are those 4 pillars. First up, you've got persons, and that means you, the whole person, not just a body part. Then there's environment, and that's everything, not just the room you're in, but your family, your culture, your community. Then health, which is your own personal, unique state of well-being. And finally, nursing or caring. That's the action, the skill that ties all of this together. Literally, every decision a nurse makes is about understanding the dance between these 4 things.
So when you take these concepts and put them all together, you get something called the nursing perspective. And this is where we find out that nursing isn't just about what nurses do, it's about how they see. Think about it this way. Every field, whether it's physics or history or art, has its own special pair of glasses for viewing the world. Well, nursing is no different. It trains professionals to look at a situation, the exact same situation a doctor or a therapist might see, but through a completely unique filter.
And that unique perspective? It's really built on 4 main ingredients. It sees nursing as a human science, which is all about your personal experience. It's a practice discipline, meaning it's about taking action. It's a caring relationship, built on human connection. And it's a health-oriented pursuit, focused on making you well.
And this first one, this human science idea, it's a huge deal. It really shows the difference. As a human science, nursing is fundamentally interested in your story, your experience of what's happening to you, not just the numbers and data on your chart. It's all about understanding the meaning behind your health journey.
Okay, that all sounds great, right? A little philosophical maybe, but how does a big idea like that actually turn into real-world care in a chaotic, busy hospital? Well, it happens through practical, established frameworks that actually guide a nurse's actions.
One of the most common tools they use is Maslow's hierarchy of needs. You probably remember this pyramid from a psychology class, somewhere along the line. Nurses use this as a roadmap to systematically figure out what a patient needs most right now. It ensures they take care of the most basic, fundamental needs first before moving on to the higher level stuff.
And here's where it gets really practical. Let's take a patient, Mr. Rossi. A nurse using Maslow's would first tackle the bottom of the pyramid, his physical needs, like his breathing. Check. Then they move up to safety, making sure his room is free of fall hazards. Check. But here's the key. It doesn't stop there. Next, the nurse addresses his anxiety and loneliness. Then, they empower him by including him in his own care decisions. And finally, they might even talk to him about his goals in life. You see, it's a roadmap for treating the whole human being.
And hey, that's not the only tool in the toolbox. The holistic health model goes even further, bringing in things you might not expect, like meditation or music therapy. This is all about using interventions that aren't just pills or procedures. It acknowledges that the mind, body, and spirit are all connected and have this incredible power to heal.
This whole holistic approach brings us to what might just be the single most important idea in the entire nursing perspective, and that's the critical difference between a disease and an illness, because trust me, they are not the same thing.
So let's break this down. A disease, that's the medical label. It's the technical problem with an organ, like high blood pressure. You can have a disease and not even feel sick. But an illness, that's the human experience of it all. It's the pain, the fear, the worry, the fatigue. It's what you feel. And it's the real reason you go looking for help in the first place.
There's this fantastic quote from Eric Cassell that just nails it. A disease is the what. The illness is the what it feels like.
And while medicine often focuses, laser-like, on curing the disease, nursing is dedicated to healing the person's illness.
Now, if this still feels a little abstract, this story is going to make it crystal clear. There was this student nurse who was taking care of a patient with diabetes, and this patient, like clockwork, ended up in the hospital every single Thanksgiving.
So on paper, the problem looked simple. His blood sugar was out of control. That was his disease. But that wasn't the whole story. As the student nurse actually spent time with him and listened, she discovered his illness. See, Thanksgiving was an incredibly painful reminder of his late wife and the family he'd lost. He was dealing with this profound loneliness, and, as he put it, he was just eating his way through it.
And this is where the nursing perspective just shines. The easy answer would have been to just adjust his insulin, but that wasn't the real problem. The student saw the root cause, his loneliness, and she intervened. She connected him with a local community center, a veterans group, and a diabetes support group. By treating his illness, she helped him finally manage his disease. And you know what? The next Thanksgiving, he wasn't in the hospital. That story, it says it all, doesn't it? It leads us right to our final and most essential point. At the end of the day, nursing is about caring for the person, not just fixing the condition.
Caring is really the heart and soul of nursing practice. It's even been called its moral ideal. It's this deep, ethical promise to try and understand and help the whole person sitting in front of you, physically, emotionally, and spiritually, the whole shebang.
And look, this isn't just some abstract, warm and fuzzy feeling. It's made up of actual, tangible actions. Providing presence just means being fully there, truly focused on that one person. Therapeutic touch can be a simple hand on the shoulder that communicates more than words ever could. Active listening means you're hearing the unspoken fears hiding behind the words. And knowing the patient? Well, that's about taking the time to understand their unique story, just like that student nurse did.
So we've come full circle, but hopefully with a totally new perspective. Nursing isn't just a job, it's a science, it's an art, it's a discipline built on a deep understanding of the human experience. So maybe the next time you interact with a nurse, you'll see more than just someone doing a task. You'll see a scientist of caring at work. Which leaves me with one final thought for you to chew on. How does this change your view of the people caring for you?